Hello, doctor. In the winter or when it gets very cold, my fingers tend to swell a bit. Their color might turn slightly blue or even white, depending on my skin tone. This happens to me every winter and it's extremely painful. I can't even move my fingers. This is a condition called Raynaud's syndrome. So, what is Raynaud's syndrome? It's a contraction of the blood vessels that primarily affects women, especially during the winter or an extreme cold. This contraction in circulation is due to the blockage of some peripheral capillaries. This blockage causes the fingers, and it can happen in the hands or the feet as it affects the extremities, to change color. You might feel your fingers starting to swell a bit and their color turns bluish or whitish depending on your skin tone, and it's very painful during the winter. Is this hereditary? No, it's not hereditary, but you might find that it's common within a family. For instance, if many people in the same family have it, that's possible. However, it doesn't have a genetic factor. So, is it an autoimmune disease? No, it's not an autoimmune disease. Raynaud's syndrome is not an autoimmune disease, but we do see it frequently in people who have rheumatoid arthritis. People who have rheumatoid arthritis or diabetes often have issues with the peripheral circulation in their extremities. This can be due to previous swelling, uncontrolled diabetes, or unmanaged rheumatoid arthritis. This leads to Raynaud's appearing more commonly in these cases. The most important thing is to keep your hands warm. You can wear gloves, or you can expose your hands to a stream of warm air to help reduce the swelling. At the same time, we can take medications called calcium channel blockers. These calcium channel blockers help prevent the condition from recurring frequently. Are there other conditions that cause hand swelling? Of course, the most common one by far is rheumatoid arthritis, or gout, which is an increase in uric acid levels. This excess uric acid gets deposited in the small joints of the hand, which can lead to swelling in those joints. The most prominent sign of rheumatoid arthritis specifically is something called morning stiffness. This is when a person wakes up in the morning and can't close their hand properly or can't straighten it out well. This is a classic sign of rheumatoid diseases, along with the swelling, of course, in the hand joints and possibly other joints like the knee and the elbow. Gout, which is an increase in uric acid, can be quite severe. It can affect the heel joints, the big toe, or the small joints of the hand, as I mentioned. Of course, rheumatoid arthritis has its own tests and gout has its own tests. Rheumatoid has different treatments and gout has different treatments. But for gout, we of course recommend reducing protein in the diet and drinking plenty of fluids, including water, barley water, and parsley tea, that is, boiling parsley and drinking it. This greatly helps in flushing out the salts from the blood and the joints in general. We'll discuss rheumatoid arthritis in detail in a separate episode, and we'll also talk about gout in its own episode. But I wanted to tell you about the most common causes of hand swelling, especially since it affects women so often. God willing, I will speak to you in detail about other bone-related diseases. Stay safe.